Welcome to a brand new edition of Skin Sense. I'm your host, Jeannine Mazurkiwecz, and we are back here with Ann Guza and Dr. Steve Schleicher. And today we are talking about a certain skin disorder. Thanks for joining us.
Thank you.
Nice seeing you.
Nice seeing you too, Jeannine.
All right, so we're talking about psoriasis.
That's correct. And some of the newest developments in the field of psoriasis. And everybody's heard of psoriasis, of course, and what is it? And we'll show you some pictures of what psoriasis looks like. Basically, individuals with psoriasis develop these plaques, okay, called psoriatic plaques. Over time, they can get very thick. The condition itself doesn't usually have any symptoms, although on occasion it may itch. But the problem with psoriasis, it just doesn't look good, okay? And it can occur anywhere on the body, including the face, including the scalp, especially the knees, the elbows. And again, it's a major cosmetic problem, although recently it has been related to other systemic problems such as diabetes, such as high blood pressure, okay, and obesity are all correlated with psoriasis.
All right, so if you have psoriasis or you know someone who has it or you think you may have it, definitely this show is going to teach you a lot about treatment, various treatments, and some do's and don'ts.
Right.
And I believe there's new products out or some treatments that we're going to talk about.
There's some products out called biologic drugs, which are injectable drugs, and they've been working very well for our patients.
Okay.
They are quite expensive, but in most cases the insurance companies will cover them. And there are, from the companies, there are different support cards and whatnot that are provided for patients also.
Okay.
So the fact that patients may feel they can't afford it should never be a factor.
Right, and these new therapies are called biologics. And it's exciting because they actually target one of the underlying causes of psoriasis, which is some sort of defect in the immune system. So what we're doing by giving these medications is, in a sense, calming down the immune system because it's overaction or reaction of the system which actually leads to the cause of psoriasis plaques. And the only problem, one of the drawbacks with these medicines is they do have to be given by injection. Okay, one day hopefully they'll have an oral medication that you can take that will accomplish the same thing. But to date, the biologics, yes, we have to inject them. And we'll actually demonstrate how easy it is because they come with injectors. You basically inject yourself at home for the majority of these, although one we actually give in the office.
Okay.
So, and one of the first ones, well actually the first one to come out was this medicine here called Enbrel. Okay, and this one has been out for many, many years now. It's been used on hundreds of thousands of patients, and it works extremely well for the majority of patients. About 80% of the patients who use this product respond. And again, it's given by injection. In this case, Enbrel is given by the patient on a weekly basis. Okay.
The patient does it themselves.
The patient does it themselves.
Usually when we're first starting a patient, though, we will demonstrate it here and give them their first injection here in the office. Not with the new with the new injection techniques that they have.
Right. If anything, it's like a little mosquito bite. And this is another, okay, somewhat newer medication, biologic for psoriasis. Again, the patient injects this, and in this case, they inject it only every other week. Okay, and again, the response rate with psoriasis is very, very good. Some 85% of the patients or so will actually respond to this medication. The newest medicine or biologic for psoriasis is called Stelara, such as we see here. Okay, Stelara is only given every 3 months once we give the initial 2 injections. But Stelara must be given in the doctor's office. So every 3 months the patient comes in and we actually give the injection. But as mentioned, very, very simple to do these injections. And Ann has an injector which we can demonstrate.
This is the Humira. And this is the second one that doctor had mentioned. And again, it is very simple to use. We do teach the patient, their first injection here in the office. But what it is it's already compact like this in this pen form. Okay. So all you do is take off the top, take off this part of it, and it can be administered in the upper arms. Although for a patient, it's a little bit difficult to do that in the arms. So it can be done in the thighs or in the abdomen area. So if I were sitting, let's say I'm using my thigh, there is a window on here, and all I need to do is put this directly on my skin, watch this window, shoot it, and wait until that window turns yellow, which it is doing.
Okay.
And that means that the injection has been given.
Is that a needle in there then?
Yes,
Okay.
there's an actual needle in here, but
Okay.
when it's pulled off the skin, it goes inside, so there's nothing to stick your fingers or anything else. And then it's put in a special container, and the patient usually brings them to us, and we dispose of them properly. But it's a very simple procedure, and that's all the patient has to do, and this whole thing gets thrown out.
Wow. Okay.
Very simple.
How often do they have to get that again?
It depends. With the with the Humira, it's every other week after the initial injections.
Okay.
Yeah.
And how do you know which one is for you?
Well, that's a very, very good question. And a lot of it has to do with their insurance coverage, okay, and reimbursement. Sometimes an insurance company will insist upon using Enbrel or Humira first, and then if they're not responding, then you can go to the newest one, Stelara.
Okay.
However, since Stelara is working so well, I have a feeling that, very soon this will become a first line of therapy also. And until the biologics, the only real effective treatments we had for very, very severe psoriasis were oral medications. And oral medications, some of them we actually use in cancer therapy as well. So they have side effects. And one of the nice things about the biologics is that the side effects are not that severe and not that great. So this is really a major breakthrough.
What are some of the side effects that the patient would see by using any of this psoriasis medication?
Well, with the biologics, we always test them to make sure they have not been exposed to tuberculosis. Okay, that's very, very important because theoretically, since they do affect the immune system, they can reactivate tuberculosis if you've been exposed to it. Okay, doesn't mean you still can't take the biologic. We would treat the tuberculosis if you have it as well, and then start the therapy. Okay. Other than that, you have to be on the lookout for infections, which, if anybody can get an infection, of course, but if you're on something that kind of depresses the immune system to start with, well, we want to be a little bit more vigilant if a person does get an infection. And then certain vaccines can't be given if you're on the biologics, okay? And we'll let the individual know which ones you can get. If you do need vaccines, well, then you do it before we start the biologics. Most of the time we don't because these are adult patients and they've already been vaccinated with most of the adult diseases. Okay. So, but again, they are a breakthrough. We'll show a picture of an article that I just wrote that'll be the cover of a major medical magazine, and the focus of that is on the biologics.
Okay, so when we come back, we will show you a procedure and our patient for psoriasis. You're watching SSP TV Skin Sense. Stay with us. And thanks for staying with us here on Skin Sense, seen on SSP TV. Again, we're talking about psoriasis and a treatment that actually helps with psoriasis. And we have Dr. Steve Schleicher and Ann Guza with us, and also our patient. Thanks for being with us once again. All right, Ann, so what are we actually going to do for the procedure?
Okay, Tom is, as you had mentioned, he's one of our psoriasis patients, and Tom has some plaques here on his elbows that we've been treating. He's had a little plaque in his scalp that's responding very well, but right now we're going to work on the elbows. And as you see, we've already given him several treatments. He had a lot more scale to this, and the condition was a lot worse previous to his treatments. This is going to be his 10th treatment with the extract laser, which is a new extract ultra laser, which is a new type of equipment that we're implementing for the psoriasis patients, and it's working very well.
All right, so let's explain why we're wearing these nifty little glasses. I've been wearing these
anytime we do any kind
lately.
Sure. Anytime we do any kind of laser procedures, we do need to protect our eyes. So it's important that we, everybody in the room, including the patient and whoever the technician is, put their glasses on. And they're a little bit cumbersome, but they really need to be on.
These. Ours are kind of stylish.
All we need is our motorcycles now, and we'll be set to go.
All right.
So we're going to start this treatment, and most of the things are already automatic in this machine. So all we need to do is pretty much program this. And doctor, if you grab me a pair of gloves there, please.
Yeah. I play a cameo role.
There you
There.
Thank you, doctor, since you're
Okay,
standing
I
there.
can leave now.
Yeah. Your services are no longer needed. Thanks
Now
for
this-
stopping by.
Yeah, anytime.
This treatment is geared, the intensity of the treatment is geared to the type of psoriasis the patient has. If the plaques are rather thick, then we would increase the intensity of the machine. If it's just a mild plaque, well then accordingly we increase the intensity of the treatment accordingly. Tom started off with a rather thick plaque on his both elbows, so we started him on a higher dose. And right now we're up to 1241, which is what we're going to program in here. So we hit the treat. It asks if this is the patient's first treatment, and of course it is not. So then we will program the 1241. Enter that. Continue. And they're asking in the machine, is this dosing correct? And then we hit yes. And then it needs a calibration, so that's what we do first. And we are now ready to start our treatment. We put on our tip. And we are ready to start. And we can dip this in an ink to mark the skin, but I really try to keep track of where I'm going. So what we do is we just wait until that light goes off and treat this plaque all the way around. And the machine keeps track of how many joules you're using. And Tom, do you feel any warmth to this treatment?
Yes.
You do feel it warm. But no blistering or anything like that?
No.
Everything has been doing fine with Tom. He hasn't experienced any blistering, just sort of a mild sunburn effect, which is what happens.
What exactly is going on when that machine is into the blue?
This is emitting a UVB ray
Okay.
of light, which instead of exposing the patient's whole body to UVB light, we're only exposing the parts of the body that are need to be treated for the psoriasis.
Is that like what does that do for the psoriasis? What is that high dose?
It breaks up the plaques.
Okay.
So we've treated that one arm already.
Yeah, because we all know that during the summertime, most people with psoriasis get better. Okay?
better.
Exactly. So we know that the sun and ultraviolet radiation has a good effect on psoriasis. Of course, it has a bad effect as far as things like skin cancer and aging go, but in this case, we're actually treating a medical condition. So what we're doing, as Marianne said, is we're attempting to break up the plaques using highly concentrated ultraviolet light.
So is it a stupid question to ask, would he benefit from a tanning booth?
Well, most patients with psoriasis do benefit from a tanning booth.
Okay.
Now, here's the thing. If someone has just isolated plaques, then to immerse the whole body, say, in a tanning booth is almost overkill. Okay, and we have one here, which we use for people. Some people have psoriasis from head to foot. And in those instances, sure, we'd like to use a tanning booth because we can treat the whole body. But when the most visible areas are, say, on the elbows or the knees or even on the scalp, then we like to localize it. We like to concentrate the rays even more, and we can use a machine like this to do that.
And we'll be able to explain our other piece of equipment a little later. And as Doctor said, that's the whole person goes in the machine.
Okay.
And that also is a laser, sort of, but it's different than this.
So how many treatments will Tom need, and does it actually clear up the whole surface to look like the rest of his skin to
That's
even
what
that
we're
out?
attempting to do. We're attempting to clear his skin. And until we do that, it may take 20 treatments. It may take a little bit more than that, depending on, with his condition. He's progressing very well now. As I said, he's on his 10th treatment now. So I think by the time we reach that amount of treatments, he should be cleared. Maybe before then.
How does psoriasis start?
Well, it's kind of insidious the way it starts. I mean, sometimes people get it after a traumatic event in their life. Isn't that right, Doctor?
It can happen that way, but nobody knows what the cause is. Okay, after many, 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 many decades of study, we still don't know. But we do know that it's something to do immunologically. okay? For some reason, the immune system is actually overactive from a skin standpoint. And what it does is stimulate skin cells to multiply faster. And when skin cells multiply faster, basically you get that thick plaque, because those are all skin cells that have actually multiplied, they died, they stick on the skin, and they have no place to go. And now if you look very, very closely, underneath all that dead skin is redness, which is inflammation. So inflammation means that something is going on under the skin to actually promote those plaques.
Okay. And what has your experience been with the procedure you've been getting done?
It's very improving.
It's improving?
Yes, it is.
Okay.
And not all patients improve with ultraviolet light. A significant percentage will. And again, we don't know why. We don't know why some patients improve and some patients don't improve. There's a small subset of people with psoriasis who actually flare up in the summertime. It's very unlikely because most people do improve.
And what about, you said that he has a spot on top of his tongue, a spot
Right
on
here
top
by his ear that we've been treating. It's a little hard to see that on camera, but that has gotten greatly improved as far as when we started this treatment. And we only did a few treatments on that, about 8 treatments we did on the...
And now this machine can be used on any part of the body?
Yes, it can.
Okay. All right.
Machine's very, very safe. That's the good thing about it.
Great.
So.
Well, thank you so much for being with us. I don't think he's going to be going in the tanning bed, is he?
No.
Our tanning bed here?
No, he's not.
Okay.
No,
So-
that would be overkill.
All right. We're talking about psoriasis here on our Skin Sense show on SSP TV. Stay with us. When we come back, we will be showing you the stand-up tanning booth and why tanning booths are good for some people. Stay with us. Well, you know, Dr. Schleicher, you tell me not to use a tanning booth, and here we are forced to stand in one together. Now, this is a biggie.
Well, this is scary because I'm with 2 women in here and I'm getting a little claustrophobic, I guess. But I think we'll be okay. As long as no one pushes the button to turn it on, we'll be fine.
All right, so we always preach that tanning booths are not good for your skin, but as we're learning throughout our psoriasis show, that there could be some benefits under supervision as far as the doctor is concerned, that there should be some procedures that help people with psoriasis.
Absolutely. And especially for psoriasis, again, we know that people with psoriasis do better in the summertime, and we know the majority of them do better when exposed to ultraviolet light. And what we use here is concentrated ultraviolet B radiation. Okay, there's 2 different forms, B and A. Most tanning salons now use primarily the A. They have a little bit of B. So a tanning salon would actually help someone with psoriasis, but not as greatly as a unit such as this, which is more concentrated.
All right, so are we allowed out now? Are you going to bake us in here?
Well, yeah, we can go out, I guess. Yeah. So we
if you
behaved.
could see around, it looks exactly like the tanning bed, and when you close it, you're surrounded, but you do, if you are claustrophobic, there is breathing room at top because it's not completely
Right. And actually in here there's 2 different types of bulbs. There's UVB bulbs and there's UVA bulbs. UVA is a little bit passe now for treating psoriasis, okay? We used to give individuals actually an oral pill that they would take that would actually prime their skin or prep their skin for ultraviolet A radiation. The problem is the pills are very difficult to get. Okay, the manufacturer stopped making them for a while, number 1. And number 2, the pills plus the ultraviolet radiation A will increase your chance of getting skin cancer. So we don't like to use that form of therapy. Whereas UVB concentrated for individuals with psoriasis is certainly an accepted and well-versed form of therapy that's been used for decades.
So this is if you have it all over your body?
Yes, this is if it's very generalized, absolutely.
Plus, with that PUVA treatment that doctor was talking about, with the UVA, with you taking the pill first, there's a chance of you damaging your eyes also. You have to wear dark glasses once you ingest that pill, correct?
Well, for 24 hours.
For 24 period of 24 hours. Right. So it gets to be a little bit of a pain, to have to do that type of treatment.
So how does this work?
This works very simply. We put our patient in there, they get undressed and they stand in here. We give them a pair of dark glasses, and all we do is program the treatment, the desired treatment in. I've already pre-programmed this for, say, 45 seconds, and we all have our glasses on. So we're going to hit start, and I just clear, and there we go.
And you
It
can
has started.
You
now,
can
if you
actually see the
not all
glow
of
coming from down below.
Not all of the tubes are lit because this is UVB, and as Doctor explained, there's two types of light tubes in there, UVA and UVB. But this is a UVB treatment that if a patient were standing in here, that's what they'd be receiving.
How long do they usually, you said that this is set for 45 seconds,
Yes.
but is that a normal range of a treatment?
It depends again on the Fitzpatrick skin type. That just means the type of skin this person has. If they're light-skinned and they burn easily, then you would maybe give them even less than that. Start them with 30 seconds and keep building up 25 seconds or so each time they come in. If they're not getting burned, then you raise it accordingly.
Where do you build that up to?
Well, we can build that up to about 2.5 minutes, 3 minutes, again, depending on this person's skin type. If they have a darker skin type and they can tolerate more sunlight, they have more pigment in their skin, we can go rather high.
Okay.
Yeah, and one of the problems, I mean, a machine like this, it costs over $10,000. So we're about the only practice in this area who has this machine. But the other problem is inconvenience, because theoretically an individual should be treated 2 to 3 times a week with the machine. And of
Well,
course,
you're not here long.
Well, it's very, very impractical for someone to come in 2 to 3 times a week.
Especially if they live at a distance
Okay.
from the office.
Right. So
For something that doesn't take very long.
Right, so that's really a drawback. Now, individuals can purchase machines for home use, and that's perfectly acceptable. And some insurance companies will actually help pay for that. And we do recommend it because home use does work. The machines aren't as concentrated as this one, but certainly from a convenience standpoint, you can't beat it.
Right.
So, and psoriasis, again, can be a very, very devastating disease.
How do you diagnose psoriasis?
Well, believe it or not, it's very easy. Okay, it's one of the easiest things in the world to diagnose just because the plaques are so classic. Okay. It's very rare that we actually have to biopsy a patient if we think it may be something else. It's extremely, extremely rare. Most patients even know their diagnosis before they come here because everybody knows. You just recognize someone with psoriasis instantly. And sometimes there's a family history, so they will have other individuals in the family who have psoriasis. And it can be, again, it can be a very devastating
And I
condition.
think over the years it's been advertised so much that people just, I don't know if we still remember the Heartbreak of Psoriasis commercial, which was years ago, and I think some people still remember that, some older folks still remember that.
While we're talking about the skin and the sun, we are getting into the months that people are in the sun, and we want to preach against sun safety.
Exactly. And machines like this, even indoor, I've railed against indoor tanning for other individuals who just want to do it because, they want to look tan. Because, this is used to treat a medical condition, okay, a disease. We don't recommend indoor tanning really for anything else, okay? It has no role today. Because what you're getting is concentrated radiation to the skin. You don't have a disease. You're doing it for a cosmetic purpose. You're doing it so you look good temporarily. But really what you're doing is damaging the skin. And you're creating wrinkles, you're creating dark spots, and you may be, creating skin cancers down the road.
And when you talk about protecting your sun, again, you want to layer up. Wear long sleeves when possible, stay in the shade when possible, but we always preach wearing a brimmed hat, sunglasses to protect your eyes.
Yeah, that's a good point. And we'll do a whole segment on a future show about using sunscreens because, that's one of the ways you protect yourself. But there are, do's and don'ts for using sunscreens and which ones to use and how often to apply. Those are very, very important principles. And I think we should devote a whole show or at least a segment to that.
That will be coming up also. Don't forget about your kids and behind their ears and their feet, the bottom of their feet, all the places that
Men tend to forget their ears a lot,
So we want to make sure that you're protecting your children as well, because that's when the damage begins.
That's right.
Exactly, exactly. And this is the time of year, of course, when we're all worried about that. And guys, of course, if you're thinning out, like I'm thinning out a little bit, people tend to forget that the sun
Luckily, you're
is
tall. No one could see up there.
Well, except the sun has a real good view of my head. And you want to be careful. You wear a cap, okay? If especially if you're fair skinned, because nobody thinks about putting sunscreen on their head, especially if they still have some hair. So but you do want to think about it because we see pre-skin cancers on the scalp all the time.
Wow. All right. Well, that's our show for today. Thanks again.
Thank you,
Nice
Jeannine.
seeing
Nice
you,
seeing you
and
too.
a lot of information on psoriasis. Again, protect yourself from the sun. Listen to your elders, I guess, as they say, with listening to people who have some skin disorders or wrinkles because of the sun in their younger days. You're watching Skin Sense here on SSP TV. We'll see you next time with a show on sun safety.